Okay, here we go with a speaker in a few seconds. Before that, I need to thank to Texila e-conference team. Is a wing of Texila American University, which provides a platform to students, marketers, and professionals across the globe to conference online, which with latest technologies evolving in the world. Things have become more convenient for people. To be a part of this world, we need to adapt to what's new, keeping in mind the latest trends. Texila American University, one among the renowned medical university in the Caribbean, plan to change the way people attend conference and has brought the idea of e-conference to reality. Texila American University is the only private university that has launched the concept of e-conferencing and has so far enlightened over 15,000 global audience to its events. So Texila American University has been developing great minds in the field of medicine, public health, business management, information technology, nursing for more than a decade. Represented by the tradition of innovation and research, we are breaking new grounds, pushing forward the boundaries of knowledge and making an impact on our student lives. We wish to continue this tradition for a future that will define our work and organization at the international stage. We have our campuses in Guyana and Zambia also. Texila American University is a private medical university in Guyana, South America. Guyana is a country where the Caribbean meets South America. That's only English speaking country in South America and is known for its lush and thick rainforest. Texila Medical School in Guyana is one of the fast growing and well recognized medical college in Guyana and listed in one of the top Caribbean medical school in the country. The constantly evolving healthcare needs of the world can only be addressed by expert medical professionals with sound knowledge and competent skills in their field. To meet this growing demand, Texila American University College of Medicine offers its medical degree program in the Caribbean. Also, we have College of Business Management as well as College of Public Health. And Texila American University Zambia is one of the most sought after private medical schools and is known for its state-of-art infrastructure and up-to-date curriculum designed to craft world-class doctors and healthcare professionals. With the education system built to international standards, we are committed to providing our students the exposure and guidance required to excel in a competitive global ecosystem. Intensive medicine and healthcare program combines theoretical knowledge and practical experience to prepare leaders for tomorrow. We have our own distance and blended learning programs as well as PG specialization programs in various streams, and Texila American Group and IAU UNESCO listed University of Central Nicaragua have signed an agreement to collaborate academically to offer the various programs from bachelor's to doctoral levels and to work in the areas of scientific research. On behalf of Texila International E-Conference, we thank our beloved partners like Texila International Journals, Confeu, Bluecrest University College, International Journal of Scientific Research, Journal of Pharmacovigilance and Drug Research. Okay, we have a nice speaker in this time. I may call upon Mr. Neel Mehta, Deputy Manager, Adani Group, India. I can give a brief introduction about him. So Mr. Neel Mehta leads the healthcare technology and futuristic projects across the Adani Group. He is an award-winning healthcare futuristic and empathy-driven medtech innovator, multi-factor and serial entrepreneur, and medical informatics with 10 plus years of experience in digital health, technology management, and strategic leadership. Before Adani Group, he founded a healthcare startup, Epic Finder, where he raised millions through venture capitals and angel investments. During his stay in USA, he has received several awards from the governor of Arizona, mayor of Scottsdale, congresswoman of the 9th district, and president of the Arizona State University. He is a TED speaker and he has been invited as a keynote speaker and moderator at several international conferences and summit. Here we go. Mr. Neel Mehta is going to present a topic under AI in healthcare, promising or threat to human evaluation. Mr. Neel Mehta, Deputy Manager, Adani Group, India. Please welcome you, sir, on the platform of 8th TWCS conference.
Thank you. Thank you so much for having me this afternoon. And it is an honor to be a part of the 8th Texila World Conference for Scholars today. And I appreciate your wonderful introduction. And, I can see that there are so many participants who are very excited to be here this afternoon. So just in order for the sake of time, I'll just share my screen to share the presentation. Please, so the planning would be that over the next 10-15 minutes, I'll give you a quick synopsis on artificial intelligence in healthcare. And then the last 5 to 10 minutes, we'll keep it for Q&A so that we can definitely answer the questions for the people and so that they can take some quick learnings today and then apply within their own group and the organizations that they are part of. Does that sound like a good plan?
Yes, sir, please.
Okay, wonderful. So I'm just sharing. Let me know once you are able to see it.
Yes, sir. I got the screen, sir.
Wonderful. Okay. Great. So good afternoon, everyone. This is Neel Mehta. Today's topic is AI in healthcare. We want to know whether it is like promising to us or whether it is creating threats in the community we are part of. So before we begin, I love social media and mainly I'm on LinkedIn. So you can tag me, you can tag the conference organization, and also you can put some hashtags AI keynote so that other people will get to know that how creative and wonderful part of the conference you are this afternoon. So we all know that humans are hooked and machines are learning while connected to our digital platforms, be it on mobile, be it on iPad, be it on laptop and the screens as well. This afternoon, we are continuously like hooked to being connected with the digital ecosystem. While based upon our behavior and moments, machines, that is like the systems, the processes are learning what we like, what we do not like, what we are fond of, and what we are afraid of. So that is what happening in the recent moving to the 22nd century as we speak. But this entire journey has started way back in 1990s when the very first wave of artificial intelligence came about, where we started valuing people's knowledge and what we call knowledge engineering. That is the time when we realized that people who have the domain expertise, people who understands the concepts, can really bring about breakthroughs. From once you started compiling different amount of knowledge, you started of what can be populated from that, what can be the proper outcomes for that. And that led to machine learning essentially. And then we started adapting to it. And what we call today is the super intelligence. A lot of big companies know exactly what you like, what you do not like. They are able to target different advertisements. They are able to target different offerings based on your behavioral pattern. And soon, you would have seen in the news, the most pertinent wave of the humankind, I would call it. That is the cyborg sense. What it means is that now the humans are getting intertwined with the machines in a way where, we see in all these sci-fi movies that the chips are being implanted into, human's brain or the human's hand. And now we are being wired as to how, what, and when, where to do. So those kind of things are coming. Those are very exciting. Those are very thrilling. And of course, it is posing a threat to the humankind as well. But as we kind of move forward, I wanted you to clearly understand the fundamental between what is the difference between artificial intelligence, what is the difference between machine learning, and what is the difference between robotic process automation. So AI is the ability of the computer to perform several tasks which are mundane, which are repetitive, and where we can predict different form of outcomes. So they are able to learn, reason, and also solve different problems. And it has been around for over 60 plus years, so that we know that how the systems have been trained and defined. Moving forward, now AI is bifurcated into three different aspects. One is the machine learning, one is the natural language processing, and the third one is the robotics process automation. So I was told that the participants have a very innate kind of understanding, and they really want curious to learn more about this. So this is something for you guys that, these are the three major definitions and the differences between the machine learning, NLP, and robotics. Once we are clear with the kind of the background and the understanding, then we'll move to the things which are like fun, which are something practical, and you will know that how you can also apply within the the academics, within the practical, and within all the internships and the so. But when being human to a machine, there's a lot of complexity which will evolve. We would not know what are the rules, what are the syntaxes, how to connect the different dots, what the power holds, who does what, when, and how, and whether it leads to the survival or whether it leads to the growth. This picture over here represents the same exact thing. And most of us, like 99% of our people today which are present will be using Facebook, Amazon, Googles, and such. So we are somehow connected to this complexity of the web of information, what we call it. So when you look at the entire ecosystem like this, you can think that you are just drowning in the minds of information, just like how we have like gold mines, like goes on. Similar to that, the information mines are being created where a lot of information, the data are being mined on a daily basis using like data analytics, using like data mining activities, so that we can understand what is going on, in the world. And through those mining, it results into several applications. We are able to understand, predict, we are able to convert this like speech, text to speech. We are able to create different visions. We are able to extract different images, in radiology, especially in healthcare, radiology, nephrology, and other places where big image-based recognitions are taking place, including MRIs and CT scans. They're based on the human psychology and the human behavioral patterns and what is being shown as a part of like once the test is conducted, then we would know what is the outcome for those. But if we heavily rely on artificial intelligence, this is something what can happen. So you really have to identify and make sure that you have the logical and the rational sense behind it. Okay, so this so we use artificial intelligence to measure a sales funnel for us. What do you mean by sales funnel? That people are using the product, how many people are currently using the product, so on and so forth. But on the right hand side, the picture is that you have found place where the sales funnel takes. So the people are not looking to escape. The people are looking to understand the sales cycle. Misrepresented, misinterpreted that scenario. So this is the situation to use AI based on your own judgment, based on your own understanding. Now, this entire machine learning is bifurcated into three different types: unsupervised, supervised, and reinforcement learning. I can show this slide to you so that you can dive deeper to this. Just we have less than 15 minutes left. I'll just come to the main point. So because of those learning, kind of unbiased and is biased. What of places or what type of entertainment is where can go. You should definitely watch the TV shows, which will give you to understand that in implementation. One is humans, the second one, which is like my favorite, which is
Mr. Neel Mehta.
Mr. Neel Mehta, we lost you. I think we have to have some.
Sure. Now am I audible?
Yes, we can.
Cool. So I was just talking about the TV shows, which is the humans, the person of interest, as well as the battle character. Something to watch, something to learn from this. If you are more on the academic side, if you are more that I really want to see what the research, what the industry is doing, then these are the two upcoming conferences which I would recommend for you to check it out. One is, of course, virtual, and one is taking place in Spain. And this entire things are focusing on the robotics, artificial intelligence, and other applications linked with those. Some of the companies, if you think we are in academia, we are at the university, which company is doing what? And these are the five companies which I've listed. One is like the Google Health, one is IBM Watson, one is Ontological Cloud Max, and Babylon. So those kind of companies will be able to give you like what kind of projects that they are doing, what kind of initiatives that they currently have. But how far should we take this? As I talk about the cyborg sense, we started with like kind of the very primitive stage of human evolution. From there, now we are hooked onto our devices. Then we are now wearing all the wearables, like such as like Google Lens. Oculus have come up with like the the immersive experiences in terms of the Facebook world. And now we are also connecting the chips and everything. So what and how it will lead to in the near future, that is something for us to ponder and think upon. And this is something when I do a very detailed sessions, there is always a poll in that. Will AI kill us? Will AI steal our jobs? And this is related like videos. This is a really cool video. If you can just put it on YouTube, okay, I'll destroy humans. And you will see that this robot has been made by Hans Robotics, one of the leading robotics companies in the world. And the robot clearly says, okay, I'll destroy humans. Fun to watch, something to consider. Then the second one is, will robots take our jobs? And yeah, practically speaking, they are taking away our jobs. But it is also leading to something what we call the creative universe, where now instead of doing mundane and the same jobs over and over again, the human minds can put to work where we think about something creative solution, providing something creative insights to the humankind. Okay, so that is a catch-22 where how you can decipher that is something of importance and urgency. But as I talked about, AI can misrepresent and underrepresent a lot of different things. So it doesn't, one kind of algorithm will not fit every kind of problems which we face. So we really have to design, develop, and implement various solutions based upon what is our requirement, where we are looking to apply, and how we are going to use it. Going forward, if you focus in healthcare, if you're focused in medicine, this is something for you to consider. This is all the application areas where you can apply AI, all the way from insurance verification to skin cancer diagnostics to responding tumors into analysis of lab of us gotten the COVID test the right? So we are somewhere related to in one capacity or the other. More on the science of like hospital acquired infections, we can reduce that. And the most important thing, which is like the point number 13 in the screen, is like the fake medical news. Just like fake political news, there is a lot of fake medical news which are going out and about in the community. So that is something what we can where we can leverage AI to solidify and nurture the problems which are there and to come up with a proper solution. What else AI can do? Okay, think about this, but I'll leave you with a couple of takeaways that there are a lot of fear. People don't like to use AI because they feel that, okay, what will happen to me? Will my job will be gone, so forth. But rather than that, start embracing it, start welcoming the AI to your own community, to your own ecosystem, like over the creative intelligence, what I talked about. Automation is one thing, and it also helps improve accuracy. These are some of the careers, if you are looking to do your post. So if you are looking to do AI, machine learning, deep learning activities, these are a couple of places where you can conduct to graduate or to switch if you're in one industry and you want to migrate to the other industry. course, you
Attendees, I think Mr. Neel Mehta facing some internet issue. We may wait for 2 minutes if he joined, or else we can move on to next presenter. I think Mr. Neel rejoined. Mr. Neel, if you can disable your video, it may get the. I think you are facing the flexibility of internet connectivity.
Yeah, I just changed the network over here at work. So
Okay.
hopefully this will be much better. I apologize for the interruptions. It usually doesn't happen, but it usually happens when it is the peak time, you know.
No problem. Yeah, you can continue.
Yeah.
Thank you so much.
Yes. So just we'll take 1 to 2 more minutes. So we are working on like telemedicine. We are working on different artificial intelligence led portal, COVID-19 management, pre-employment cell checkups. We have a lot of dashboards which are automatically created. You know, there are insurance coverages which we manage. Of course, lifestyle interventions when you're working like 9 to 5 at work. A lot of physical issues may arise. So how to overcome those, and then we also monitor different employees at site. So the future is about the collective collaboration. You know, if you are not able to collaborate, if you just work in silos in your own domain, you will not be able to come up with like great outcomes. Simply the technology. It is also about how the human experience is like which the technology enables. You know, the technology should work, especially when you are presenting. However, today is not working, but it is also creating a good human experience between us today. This is something like the future. And I strongly believe that we will have like a lot of flying vehicles out in the air. We will have everything digitized, automated, and then the humans will just be thinking about what next to create and evolve on this planet. So thank you very much. This is me, Neel Mehta. You can connect me on LinkedIn, and I've given you my WhatsApp number. Please, if you have any questions, I'm happy to take and then go from there.
Thanks. Thank you, Mr. Mehta, for the wonderful presentation. Attendees, do you have any questions? You can raise the hand or you can post your questions in Q&A session.
Yeah, I just went through it at a very quick pace. Just I wanted to, you know, respect everyone's time, and so please ask. Yes,
sure. Mr. Mehta, like, can you please let us know what are the upcoming projects of Adani's in AA?
Yeah, so at Adani, we have a lot of healthcare projects. We have a big team of like doctors, healthcare professionals such as nurses, medical assistant, dietitian, nutritionist, you know, physiotherapist, data entry, data analytics people, IT, and such surgeons and everything. So together as a collective team, we do 3 major things. One is we manage the entire employees' health. We have 23,000 employees, 23,402 to be precise as on today across Pan India. So we manage not only their health, but their immediate family members' health. We monitor them if they are hospitalized at any part of the country. We work with various hospital systems to ensure a good care coordination for our employees. We also take care of their lifestyle interventions in terms of, you know, we do provide a lot of holistic health and wellness. On the project side, we run 2 various hospitals in Gujarat. We are coming up with a lot of creative initiatives where we partner with various IT-based companies, where we partner with various community-led centers. So it is more on the back-end side. So yeah, all together, it's a big team, a lot of creative projects which we do. And we are now also doing the predictive data mining, especially in AI. So when I joined, it was all on the pen and paper based. Now it has been digitized. So now what we are working on is like, let's say if I have an employee or any individual's data over the last 3 years, now our systems are able to predict whether they will get any cardiac arrest, whether they are on the verge of getting diabetic, whether they are going to become a diabetic in the near future, what are the chances of them getting cancer. So the earlier we predict, the earlier we can inform those employees and their family members so that they can start changing their lifestyle and either prevent it or make sure that once it happens to them, they are able to face that and do it in a much more proactive manner rather than the reactive manner when sometimes it becomes too late. So those are the initiatives where we use AI, machine learning, and other things at a very large scale.
Great, great, Mr. Mehta. We have a few questions. What is the
Sure.
future of artificial intelligence in public health?
So that's a great question. I would say the latest example where AI came to use as a part of the public health initiative was the COVID. And if almost all of us have used the COVID application, which was developed, designed, and created by the government overnight during the first wave of COVID pandemic. And you understood that, like, when you log into the app, you have to click on Bluetooth activation, and it was able to sense how many COVID cases are there within the area where you are currently residing, how many were severe, how many were not that serious. Correct. So those artificial intelligence came because, of the geography, geotopography connectivity. The second part where the AI was very helpful is we were able to predict the waves. A lot of big scientists at WHO, even at India with Ministry of Health and Family Welfare and Department of Public Health and Department of Biotechnology, DBT, they knew that, okay, that this entire pandemic will have at least 3 waves. And so we were prepared for that. Of course, the public didn't take it that seriously, and a lot of people had to suffer a lot of different challenges. But with the AI, with the understanding of the virus variants and everything, we were able to capture it, mitigate it, and also troubleshoot it in a very cost-effective manner compared to not knowing that. So public health AI is a great combination. There are a lot of projects which are also taking place by currently our government. There are several companies out in Gurgaon and Noida, especially in North, who are doing a large-scale public health surveillance, we call it, through which we are able to detect or identify any kind of outspread, just like COVID pandemic, on a day-to-day basis.
Great. We have one more question.
Sure.
How do we draw the line for data confidently and A? Can data available to individuals, corporations be used as feed for AI?
Sorry, can you please repeat?
So, like, where and how do we draw the line for data confidently and A? Can data available to individuals, corporations be used as feed for AI?
Okay. Yeah. So that is a great question. It is linked to data privacy, if I understand correctly. So when you talk about data, it is always good to mine and collect all the data. So even here at the group, we never reveal the employee name or identity to either HR or to any of the boss or to their family members until it is certain that this is what is going to take place. We identify, we mine the data, we collect the data, we review the data, we perform different analytics on a completely confidential identities. Okay, so we maintain that confidentiality to the greatest level. Of course, that confidentiality can be managed when it is one single entity. But when multiple entities are coming together, you really have to create a structure where the confidentiality or the data privacy is taken to a greatest extent possible, and through which you can carry out research and you can come up with the good practical solutions. One thing I would say that as long as your sensitive financial or any personal data is harming you, then you have to worry about why my data was being shared or leaked or lost. But as long as that data is giving you a good positive outcome, okay, is helping you nurture your credibility, nurture your health, nurture your your economic sustenance, it is good that companies are taking so much efforts to mine and work on that data. We think about that, okay, the privacy is lost, But think about the other way, if I'm scrolling on Facebook, if I'm scrolling on Instagram, and if I was thinking about, okay, I wanted to buy shoes and suddenly a shoe pop up, I just click on it, I just select my sizes and I order it. How easy it is. I don't have to spend like 1 hour going to the city or going through like various shops and purchasing the shoes. That data or that my behavioral understanding was used to save time. That is number one, to give me a comfort and convenience. And the third thing is both the companies made money. Okay, but if that same data is used to harm me or to create some conflicts, then it is not good. That is the line which you have to draw.
Thank you, Mr. Mehta. We have another question. Will artificial intelligence in health be applicable in the context with limited internet connectivity?
Oh, that's a great question. So I had the same challenges about the limited internet connectivity. I don't know why. But I would say that, it is always important to take steps to creating AI-based solution, artificial intelligence-led based solution. One thing which I'm also consulting at the moment is a tele-ICU concept. Okay. A lot of government does not have that great infrastructure to provide a very good ICU services to the below poverty line patient population. So over there, as master, care coordinated surgeons, care coordinated ICU specialists are sitting at a center like, just a room like this where we have big ICU screens of various hospitals and they are monitoring patients. Guess what? Sometimes the internet goes away, in the 24-hour surveillance at the ICU, maybe or 30 minutes or 40 minutes are lost because of the poor bandwidth or the poor internet connectivity. But think about, the remaining 23 hours of the data, the observation and the understanding conversation between the medical providers at that remote location where the patient has been hospitalized and admitted to the ICU. Now they are getting the expert support and the supervision of someone who is in the major cities like Chennai, Bangalore, Hyderabad. Okay, so because of that internet, because of that AI-based approach, now the care is also accessible at the remotest location in the country. That would not be possible if we always think about, okay, that if the internet is not there, if the bandwidth is not there. It is always about creating steps, working on it, and then solving as the problem comes along to come up with a great and good enough solution so that there is a practical application is given to the end user. So in healthcare, mostly it's always the patients.
Great, Mr. Neel. I think we have run up with the questions. Thanks for your wonderful presentation in AI with artificial intelligence in public health as well. Thank you for your time.
Thank you so much for having me. Have a wonderful rest of your conference, and this is exciting. Appreciate it.
Thank you so much. Probably we meet with our upcoming conference as well in AI.
Thank you. Thank you. I look forward to our engaging relationship and looking forward to working with you.
Thank you. Bye-bye. Dear attendees, we had a wonderful presentation from Mr. Neel Mehta.